And we are live. It's Dr. J in the house. Today, we're going to be talking about nebulizers, how to use nebulizers to support your immune system. If you have immune stress going on, what can you do to use a nebulizer to help get over that immune stress hump? We'll dive into this topic. Before we do, please love to see your comment down below. And again, please smash that like button. Really helps the search algorithm. All right, so let's dive in. So we're going to be talking about some controversial stuff here. Make sure you run it by your conventional doctor. A lot of these things is more anecdotal evidence about it. Doctors and patients trying things and sharing it. We'll talk about how to use a nebulizer right here and how to use it to help kind of support any inflammation in your sinus cavity, in your respiratory cavity. We'll talk about that out of the gate. And we'll put links down below as a pinned comment. We'll put some of the studies down below. We're going to be talking about hydrogen peroxide. We're going to be talking about silver. We'll be talking about glutathione and N-acetylcysteine and how to use that in a nebulizer. So first off, when we get a cold, right, an upper respiratory tract infection, it starts off in the nose. So the first thing we can do is knock down the viral load. First thing we can do with that is we can do a combination of a sinus flush. So this is saline. So we use NeilMed packets, which is a saline packet. We use RO or distilled water. You do a packet, fill up 8 ounces of water, and then we'll do 1 to 2 drops of betadine iodine, or we can do 1 full dropper, 1 milliliter dropper of silver, a high quality, like a Sovereign silver or my GI Clear 3. It's going to be like a 5 or like a 10 to 15 ppm silver. Or we'll even do a hydrogen peroxide, usually like anywhere between 2 to 3 drops of 3% food grade hydrogen peroxide. Pick one or the other. I like iodine. There's a lot of studies on iodine in saline to be very effective at lowering the viral load, lowering inflammation in the sinus cavity. So I love that out of the gate. So first thing we'll do is, and this is kind of the whole flow, right? Because you have a nebulizer. Here it is. Mine's actually cleaning right now. How I clean it is actually get some 12% food grade hydrogen peroxide. You can do 3. I just have it because I use it to clean my cold plunge in the back here. Put just a little bit in here, run it for 5 minutes, and it basically cleans everything out. You want to go with food grade when it's going inside of your body, with the exception of gargling. Gargling, you can use a regular drugstore type hydrogen peroxide, but if it's going in your nose or you're breathing it in, you want food grade, so there's no stabilizers in it at all. Stabilizers are not the best. If it's a quick gargle, rinse, not a big deal. If it's going in your nose, in your lungs, you want food grade. But this guy may not even have to be used if you follow the first steps above. And I've done videos on this. We'll try to put it as a recommended video at the end or a pinned comment. Take a look at those. I'm trying to give you, as I learn and kind of evolve and get thousands of patients under my belt and try different things, I'm just trying to put a compendium of work together that consolidates everything. So first thing out of the gate, we have our, okay, here we go. Got them all right here. So we have our Xlear. So Xlear is your first therapy, your first line of defense. So if it's a cold, we're going to be doing Xlear Rescue because it has certain botanicals in it. It's going to have podiarco. It's going to have grapefruit. It's going to have tea tree oil in it. It's going to have oregano. It's going to have parsley. It's going to have eucalyptus. And that's pretty much it. Okay, so this is going to be good for any upper respiratory tract infections starting out. You're in a crowd of people. People are sick. You're first starting to feel anything at all. 2 spurts. Breathe it in. You want to feel it go down the back of your throat. You want to be able to taste it, and it should be spicy. Pretty strong, but the first thing you'll notice, that's a natural reaction, is it will start to mobilize mucus down the back of the throat, any post-nasal stuff, anything up the sinus cavity. It'll mobilize it and start to help it run out. And so I may have to grab a tissue here in a minute just to get that flushed out. So that's really good for mobilizing mucus. And the compounds, the botanicals in there are all shown to have their own antiviral, antibacterial properties, really great for breaking up bacteria and mold biofilms. Now, this is great if you got a kid who may be a little bit more sensitive, or you're having issues that are more chronic and you want to use it day in, day out. You can go with the one that does not have all the botanicals. It will have grapefruit in there, and that's the regular Xlear. There's also one for people that use it more chronic with allergies that have sinusitis. That'll have the same formula, but it'll have a little bit of capsicum and it'll have a little bit of aloe in there, a little bit more soothing. So you'll see kind of like green bottle for the Xlear Rescue, bluish bottle for the regular, and red for the Xlear Max. So acute colds, pull out the Rescue. 2 squirts, let your nose start to run. Sinus flush, 2 to 3 seconds, blow your nose. 2 to 3 seconds, blow your nose. Okay, and then after that, 2 more squirts, and then you're done. That's the general flow protocol. If you start with first sign of any symptom at all, or if you're around people, it's around the holidays, bring this guy with you. As soon as you're done, right up your nose twice each time. That's a great way to do it. If you do that, your chance of having any issues with lower respiratory tract issues in the lungs goes down greatly. So that's my first hack, is deal with the upper respiratory tract infection first. Viruses and inflammation start here. They replicate, and that's where it starts to get bigger and bigger, and then it goes to your lungs. Now, once you start to have inflammation of the lungs and you start to have bacteria hang out, because usually the bacteria, if it's viral first, is secondary to the viral infection. And so once that bacteria gains a foothold, it basically doubles every 20 minutes. And so that's really hard. Once you get to that level, it may be hard to avoid antibiotics. Again, talk to your doctor. This is not medical advice. This is just my clinical experience that I'm sharing with everyone here. So take that with a grain of salt. So first thing we do is we do our protocol. We do our Exlier rescue, spray, flush, blow nose, spray. You can do that anywhere between 2 to 3 times a day, or if it's acute, you can do it every couple of hours. If there's green stuff coming out, keep doing it to keep all that green stuff gone. Green and yellow just means you have an acute infection going on. It's the dead soldiers of your immune system from fighting that infection. The darker green it is, the more white blood cells, the more inflammation you have from that infection. So that's the first thing. Now, if it's starting to go deeper, or you're prone to these infections in the lungs, the first thing you can start doing is oral NAC. Oral NAC is wonderful. It's a mucolytic. It's also a powerful antioxidant. It'll start to break down the mucus. If the mucus is more viscous and liquid, it's not going to block oxygen as much. High levels of mucus, it's going to be fertilizer for infections to grow. It's going to be fertilizer for secondary infections to grow. It's part of the reason why a lot of kids, young kids, once they get mucus up their nose, they get ear infections, because you have eustachian tubes that come, right from here over to your ear canal. Kids are more horizontal. Adults tend to be a little bit more angled, so mucus can drain for adults. For kids, it's more horizontal. And so if we get a bunch of mucus up their nose and they're not blowing their nose correctly or appropriately, or they're doing this thing where they're reverse sucking their nose up, all that mucus, that's going to block the eustachian tube, can travel to the eustachian tube and create ear infection. So first thing is, do this to prevent the ear infections. I got to get a tissue because this is making my nose run. Give me 1 second. All right, yeah, this will make your nose run like crazy because you have lots of xylitol and herbs that break up the mucus. So this is wonderful for post-nasal drips, because a lot of times you essentially have a reverse runny nose. Instead of your nose running down this way where you blow it, it's running down the back of your palate, dripping down into your throat. It's irritating those cilia and causing a lot of mucus and a lot of irritation and causing that cough to happen. So really work on the Exlier rescue. My hair's all getting disheveled here. All right. So we got the Exlier, we have the sinus flush, we have the Exlier. All right. Now, what are we doing internally? We're taking NAC to break up the mucus. We may also do like a natural Mucinex. So Mucinex comes from the guaiac bark called guaneficin. So you can find that guaneficin extract. We'll put links down below. Mucinex has some colors and dyes and some junk in it, but it has that herb in it that breaks up mucus, makes the mucus more thin. So that's great. We want to make the mucus thin. The more we get the mucus thinned out, we flush it out of there, the less chance we have of infections, and also a better chance of keeping our oxygen levels up higher. Also, if we have low oxygen, we can also take things like arginine or higher dose melatonin. Those have been shown, according to the literature, to increase the oxygenation. So if we need it, we can definitely do that. All right, next thing. So now we have our nebulizer. So in previous videos, I have my Philips InnoSpire. It doesn't quite lock anymore, and I haven't been able to find a new one for it. I like this one. It's great. It's probably a little bit better than this one. This one's a little bit more cost effective. So this is a travel nebulizer. I like it. It's quiet. You can bring it with you. It's got a USB-C in the back, plus it's got batteries. So, I mean, you can't really beat it. Anytime you travel, definitely bring one of these. I always travel with flush bottle and typically Exlier. I really, only during the virus a few years ago, I did this preventatively just to be careful, but I've honestly never had pneumonia in my life. And as an adult, I've been on top of doing my flushes the last 5 or 6 years, and I'm usually able to nip it in the bud if I can do that. So you can bring it with you. It's still great to have. So first thing you do is you have to clean it out. I use 3% hydrogen peroxide, food grade, just a dab in there, just like maybe a milliliter. And it'll dissolve through it. You turn it on like this, and it'll just go through it in about 5 minutes. And then that whole airway is nice and clean. Hydrogen peroxide is just an oxidizer. It's H2O 2. So it's water plus an extra molecule of oxygen. And so the goal, if you're using hydrogen peroxide, for instance, as a nebulizer, you can do about 7 drops of hydrogen peroxide, 3% food grade, and you mix it with 10 mLs of nebulizer-based saline. You want to make sure it's sterile. Anytime you're breathing stuff in your lungs, you want to make sure it's sterile. So I get it in these little blister packs. That way there's no preservatives in it. Each little blister pack is 5 ml. So you would do 10 if you want. 10 will make it a little more diluted. And if you do about 7 drops of hydrogen peroxide at 3%, that'll bring it down to about 0.1%. You'll see a lot of side effects and a lot of articles, people talking about it being bad. The reason why it can be bad, if you just do it straight, if you just do 3% hydrogen peroxide, it's going to burn the crap out of your lungs. And also you need one, and it can't be regular hydrogen peroxide. It's got to be food grade. So all the stabilizers are out. And 3, it has to have saline that is pH balanced and sterile. So saline is going to have a combination of USP, United States pharmaceutical grade, sodium, chloride, and bicarb. So it's pH balance for your lungs. Even if you have lung issues, if you just put sterile saline in here and breathe in saline, that'll also clean out the lungs a little bit and kind of allow some of that mucus to go out. So if you're sensitive, you can even just get a travel-based nebulizer. I'll put links below, and add some saline. You'll get some relief out of that as well. Just like if you do a saline flush with this, great relief. If you add a little bit of hydrogen peroxide, tiny bit, or a little bit of iodine, tiny bit, 1 or 2 drops, it'll be even more effective. And again, if you can feel spiciness or irritation, it means you're doing too much. All right. So with hydrogen peroxide, 0.1%, about 7 drops per 10 mLs. Or if you're doing one of these, it'd be about 3 drops. We just round down to 3 drops. You can also do, and again, these can be used interchangeably, not all at once. You can also do a really good clean silver. There's some good brands of silver out there that have been around for a while. One that comes to mind will be like a Sovereign Silver or an Argenta 21. These are going to be low ppms, 10 to 20 ppms. Silver is going to be mostly saline, 99% saline anyway. And so if you add that plus a saline carrier, you're going to be in pretty good shape. And again, talk to your doctor about this. This is not medical advice. This is just for your entertainment. All right, so we have hydrogen peroxide, food grade. We have potential silver. And we also have NAC. So there's a medication that's been out there since, I want to say, the 70s called Mucomyst. And this is used a lot of times for cystic fibrosis kids where there's a lot of mucus, a lot of lung health issues. As NAC, which is N-acetylcysteine, has been used as a mucolytic. It's natural. It's an amino acid. It's found in food. It breaks down mucus. It also powerful antioxidant for increasing glutathione, and it's a powerful antioxidant. It helps with oxidative stress and inflammation in the lungs. A lot of studies on it being very helpful. Just taken orally, really helping with mucus, really helping with antioxidant stress, really helping with glutathione. Lots of good benefits where it can even help with glutamate in the brain. It's shown to be helpful for OCD. There was a study a few years back looking at NAC compared to minoxidil for hair loss, and it proved to be even more effective. So I love NAC, lots of good benefits. And so you can do it orally. 2 grams a day is effective. If you do too much, here's the side effect. You're going to have either dry eyes, dry nose, dry mucus membranes. So that's the big side effect. It's mucolytic. It breaks down mucus. You have less mucus. So now you get dry mucus membrane. So if you have dry issues with that, dry eyes, then you probably want to pull back a little bit. Just spread it out more evenly and just pull the dose down. NAC has even been shown to be effective for decreasing miscarriage at 600 milligrams a day. So very effective. So you can, if you look at the Mucomyst medication, again, if you have issues, lung issues, please go get to your allergist or get to your respiratory pulmonologist doctor for a prescription. Again, here's how you can do it at home. Again, you want to use sterile saline. Anytime you're breathing something in, sterile saline. So you can do 10 mLs of sterile saline. If you look at the Mucomyst medication, it's between 3 and 10% solution. So it's 3 to 10% NAC. So if you take 10 mLs of saline and you mix it with anywhere between 300 milligrams to 500 milligrams of NAC, that'll bring it to about a 3 to 5% solution. And again, just get the cleanest NAC you possibly can. If you can go to a pharmacy and you can get it compounded so you know it's super sterile and clean, that's the best. Or if you have a brand that you know is good, ideally in a capsule, so it's not going to be oxidized and it's been protected that whole time in that little gel cap or that little cellulose capsule. You can open it up. You can pour maybe half a capsule in. If it's 600 milligrams, half a capsule in. You add your saline in there, your 10 mLs, and then you just pop it in like this. So you do your saline, put it in, half a capsule, 600 milligrams, so half is 300. Put it in, close this guy like this, Okay. Give it a little shake. Make sure it's all shaked up. Press the button. Go on, and then you will see the mist start to come out. And then you would just do this. And I'll put a saline in here so you guys can see it. Because breathing saline in, honestly, is still really good. Just like flushing your nose out with saline. Sterile, clean, no problem. So I recommend always have like 20 or 30 of these saline guys around. You could do distilled water, by the way. I just prefer to have it pH balanced. Distilled is not going to have any of the minerals in there. See, you see it already going now? See it already going? So I'll turn it off here. Okay. So I already went through hydrogen peroxide. Okay, so that's going to be 7 drops per 10 mLs to make 0.1%, or 3 drops per 5 to make 10% to make 0.1%. You can do a high quality silver. Make sure it's a really good reputable brand, ideally stored in glass. Okay, and you could put a full 1 ml dropper in that. Do your carrier saline just like this. You can do NaC, 300 to 500 milligrams per 10 mLs of sterile saline. Put it in like this. Once it's in, I like to do 10 more saline because then it's more liquid, and then it makes it very easy to get into your system, into your lungs. And then you can also do glutathione. So here's a great product. It's a reduced glutathione. This is mixed with bicarbonate. It's a wonderful product. If you go to justinhealth.com/glutathione, I'll put a link down below. This is a good one because it's reduced, and it's just the ingredients are as clean as can be. It's reduced glutathione and baking soda. So it just blends super well. Yep. Reduced glutathione and sodium bicarb, which is baking soda. And so for this guy like this, pretty simple. You can see nice, clean white. I like it in capsules because it's less prone to oxidize. And so I'm going to just take this and pour it in. I'll try to do it so you guys can see it. I don't have like 4 hands, so it's harder to do it. All right, hold on. Okay. See that effervesce a little bit. Close it up. Now you're good to go. Give it a little shakesy. And this is 200 milligrams per cap. So you can see the solutions. It's really clean. And so you can do this. Just like that. So pretty straightforward, especially if you have a kid who has aversion to pills. It could be a nice, good option. Even if it's just saline, it's a good option. And again, conventional medicine, a lot of times they're not going to support a lot of this. They'll do like tobramycin, or they'll do some antibiotics in a nebulizer, which, if you have a serious lung issue, I'd much rather see you bring it to the lung directly than take something that's 3 feet away from your gut and then have it go systemic. So I do like nebulizers just because I'm for bringing the treatment as close to the issue as possible. But I'm also about prevention. So first kind of protocol is get your Xlear Rescue spray. Start that. Then you can do Xlear. Here's the order. Xlear Rescue, 2 to 3 second flush, 2 to 3 second flush. You're blowing your nose in between all these. And then 2 more squirts, 2 more squirts. And then if you're in the middle of a cold or early on, 2 to 3 times a day is fine. If you're right in the middle of it and you're got a lot of mucus and a lot of green, you can go every hour or 2, 5, 6 times a day is fine. And then if you want to be more on top of it, you add in your nebulizer. You can do your nebulizer and with your saline and maybe a 0.1%, like I mentioned, or the silver, or you can do your NaC, like I mentioned, the 3 to 5% solution, and you can also do the reduced glutathione. So pick one. You can alternate them. It's fine. Just want to give you guys some options, because if we can be more on top of prevention, it's going to help your immune system. It's going to really give you some other options to not have to go deep into an infection. Antibiotics are great. We want to use them as a last case scenario, ideally. So the more tools you have, the more you know. All right, guys, any questions, feel free and let me know. We'll repost this up there here. I'm going to put links down below to get everything. So I'll put a link down below for the nebulizer, for the glutathione, justinhealth.com/glutathione. That's a great glutathione. Regarding the NAC, I'll put some links to my favorite ones. I'll put links. And then if you go to justinhealth.com/sinus-flush, you'll also get the video of me doing the sinus flush and a lot of the links. But we'll put them all down below so you guys don't have to hunt. Just give my team a couple of minutes here to get that up, maybe a day or two. All right, guys. And any other questions so far on everything here? Thanks, Gabe, for the feedback on that. And any questions, let me know. Put it in your comments. I want to make sure you guys have a lot of tools. I'm all about prevention, putting the power back in your hands. And again, this is not medical advice. If you have a lung issue, if you have a sinus issue, please see your conventional medical professional. I just want to give you guys some tools at home that you can jump on board with if you feel so advised. All right, guys, comments down below. Appreciate it. Have an awesome day, you guys. Take care. And by the way, if you want to dive in deeper, if you need more support, link down below where you can reach out to myself and staff. We see patients worldwide if you need more support and help on this. All right, guys, take care. Bye now.